Welcome back. I'll now quickly show you the additional details that you have the option to enter if you choose to submit and continue. Remember that all of these fields are optional, so you can pick and choose which you want to complete. The first is the page where we ask for additional details that may not have been captured elsewhere. This is a free text, so you have the freedom to enter anything you feel hasn't yet been sufficiently covered. You can also share additional non-pharmaceutical therapies that the patient has tried by selecting all that apply from the checkboxes, including the other option. Select continue to go to the next screen. And next we ask about what your priorities for long COVID research are. For example, what medications you would ideally like to see prioritized for study and which symptoms you think are most important to find treatments for. Next, we ask about some basic demographic details about the patient, like their age, sex at birth, and gender identity, followed by country and race and ethnicity. I will select that the patient was 21 to 30 years old, female, and that their gender identity is the same as their sex at birth. I then can select United States from the top of the list and choose the patient's ethnicity and race. We then ask about whether the patient was pregnant either during their acute COVID-19 infection or during their experience of long COVID symptoms. And then we come to the page where we ask about the medications the patient was taking regularly prior to their acute COVID-19 infection, which they continue to take. For example, the patient might have been taking rosuvastatin as a cholesterol lowering agent, which I would therefore include. Select continue to move to the next screen. We've now reached the section where we ask about the patient's acute COVID-19 infection, which led to their development of long COVID. We ask when the patient's acute COVID-19 symptoms began, if it was known, how the acute COVID-19 infection was diagnosed, including that you don't know or that it was suspected but not confirmed, and you can choose multiple options here. Then select continue. We then request that you provide information about the level of care the patient received during their acute COVID-19 infection, what medications, if any, the patient received for their acute COVID-19 infection, and whether they developed any of the following complications. Now we ask about the patient's vaccination status, about whether they were vaccinated against COVID before they got infected. If you select yes, then options appear for the type of COVID vaccine that they were given, with the ability to select multiple, as well as how many doses they had received prior to becoming infected, and how long the patient's symptoms started between when they were vaccinated for COVID-19 and when they became infected. Finally, we provide an option to add additional details by uploading images such as testing results, x-rays, or lab reports. Please note that this is entirely optional and that you do not have to upload any images or documents. However, if you choose to do so, select the image and then add it here. Please do know that any images containing personally identifiable information will not be accepted. So please make sure that that information is removed prior to their submission. Finally, you've reached the final review page where you have the opportunity to review the information that you have previously entered. You can edit the information by returning to the menu bar and going to that section of the case report form. And once you're done, scroll all the way to the bottom and hit submit to enter your case. Thank you so much for entering your case and adding these additional details. Stick with us for the next video where we talk about how this information will be used. And thanks for contributing to CureID.